Hello, and welcome to Health and Fitness Redefined. I'm your host, Anthony Amen. Join me today as we take a dive into the world of health and fitness, where we learn how to overcome adversity, depict fact versus fiction, and see health and fitness in a whole new light. Today, we have a very special guest on, Dr. Olsen Figlo. Welcome to the show.
Thank you, Anthony.
I am super excited to finally have you on this show.
I know we've been planning this for quite a while.
Months.
Yeah. I might have dropped the ball, so sorry about that. But I'm here.
You're here, and that's all that matters. And
yes.
The content we have planned for this show and the education factor, I think, is going to be huge and important because a lot of people don't know. But first, explain to us what you do.
Okay. So, hi, everyone. Dr. Dawn, podiatrist, foot surgeon for over 20 years, and the founder of The Organic Foot. So, with The Organic Foot, I am going basically into the world of wellness, holistic healing, and teaching people how they can heal from their foot up. So, that's really the crux. Just really realizing how important the foot is for overall health and wellness.
So why did you want to become a podiatrist? What was that? Because I'm going to be honest, not most people wake up and say, let me stare at feet the rest of my life.
Yeah, that's a great question. It wasn't a dream where I saw feet. I actually knew I wanted medicine. I went pre-med, undergrad. I knew I wanted something in the realm of the medical field. But what was holding me back was how I also knew I wanted a family. I was married at the time. I got married very young. And I said, what field within medicine would work for me as a woman where I could raise a family, be a part of that family, and practice and help and treat and cure people. Well, I don't like to use that word cure so much, but help people. So anyway, then I was introduced to a woman who said, did you ever think about, actually as a family member, a cousin of a cousin, and she said, did you ever think about podiatry? Did you ever think about feet? And I said, no, I never did think about feet. And she goes, well, you ought to, because I'm a podiatrist, I have 3 children, and it's just a beautiful career. And honestly, I think she said that, and within 6 months, I was enrolled at the New York College of Podiatric Medicine. And that was over 20 years ago.
That was it. Just one recommendation and then boom.
That was it. Another, I don't know how many years of my life. 7, 8.
You went to podiatry school. You became a podiatrist. You
Yes.
started practicing?
I started practicing, yeah. And I practiced for many, many years. Yeah. And then about 7 years ago, I started to open my mind to natural solutions and really focus on what is the root cause of most foot problems and knee and hip problems. And how that can be actually corrected non-surgically, even though I came from a surgical background. My whole residency was surgical. So yeah, it was a shift. But I also incorporated a lot of plant medicine, knowing that these plants are here for a reason and they can help us without side effects. So I really, that's when my mind opened and I founded The Organic Foot.
Wow, I love that.
Yeah.
What a story.
Mouthful.
It's all good. So The Organic Foot, that's something you started to help people find more of underlying conditions about why things are starting instead of just going under today.
Yeah, well, basically, and even beyond that. So natural solutions to foot problems, for sure. But beyond that, how the foot can be a conduit to healing, overall body healing. And that's really the part that I love and that I have such a passion for. And there are some, I would say, well, I have right now 4 pillars in The Organic Foot. And one of them we were just discussing is alignment and strengthening the foot. And then we have plant medicine and earthing and how important it is to get our bare feet in the soil.
I want to talk about all of that.
Yeah.
But I want to break it down just because, for my specialty and for our listeners, where fitness I think is a great place to start.
Absolutely. I think the biggest takeaway from over 20 years of practicing is that we don't have strong feet anymore. And when our feet get weak, the arches collapse. And when the arches collapse, the joints in the foot, especially the big toe joint, that begins to jam. We see bunions, hammer toes, neuromas. So it's all really, if you go back, it's all due to the loss of strength in the foot. So fitness and the foot, really, really important.
So let's talk about that, because something I always bring up to my clients when they come and see me is a common question is shoes. What should I wear? It's serious, because a lot of people ask, they come in and they go, all right, they're wearing running shoes, for example, and we're trying to squat.
Right.
And they're saying, I can't get my weight back. And I have to explain to them because running shoes are tilted forward. So your foot's being pushed forward in a running shoe and you're trying to squat and sit back, it makes it nearly impossible. So then I make recommendations of buying flat shoes like Converses, or if they want to go fancy, they're more than welcome to buy CrossFit shoes. But something that doesn't put their weight forward to help them squat. So in your expertise, is this wrong where I'm coming from? Is this, I want to get a little bit of outside knowledge of how you feel about different types of shoes when it comes to exercising.
Yeah, good question. Well, and I have two roads here that I want to go down. One would be the actual shoe, and the other would be to, exercise and do some barefoot exercising. Because that's so important to use the 3 planes of motion in the foot and get strength from the foot. When we're in shoes, we're only using 1 plane of motion. So we do lose an opportunity to have the foot get stronger. But with that said, okay, let's go back.
Because to LA Fitness, they're making you wear shoes.
Right. Yeah, but you know what's kind of cool now? Some gyms have the grip socks, and I anyway, okay, we're not going to go down there, but I love them. So with shoes, be careful, like you said. If a shoe is specifically for a certain sport, it is designed for that. Like biking shoes will be designed in a certain way that it's going to hold the foot when you're on the pedal. So if you're using a biking shoe for running, no good. And if it's just overall fitness, just go with, a cross trainer or something like that, not a specific sport, because that's when you can wind up in trouble. I'm a big fan of orthotics, custom orthotics, in particular, because they actually hold your foot in your, what we call it, subtalar neutral, right? So it realigns your foot in the perfect position and arch so that your knees are protected and your hips and your back are protected. But with that said, a lot of people do not have custom orthotics, but a nice arch support would be fine. So if you do buy a decent sneaker or a sneaker that is for multiple sports, like a cross trainer, just throw in an arch support and you're fine.
Throw in an arch support and you're fine.
Yeah.
I'll be honest, the benefit of having my own gym is when no one's there, I work out with no shoes.
There you go. See? It came out.
What a difference, though. I'm gonna just state this for
Right.
the record. When you're doing big lifts like deadlifting and squatting, you're able to actually grip the ground with your toes, and you're able to produce so much more power.
Yeah, absolutely. And
out of this world.
Yeah, just think about it, right? And not only that, you're using your toes. How many? Well, I'm sure the general public doesn't see too many hammer toes, but I see toes that are crunched up all the time, and that's from ill-fitting shoes. A lot of times, right? We're squeezing into pointed shoes, and even some sneakers are very narrow, and that will create the toe to sit in a crunched, contracted position, even in the shoe. And now you're working out with that, but you're not using any of those muscles. So when you're barefoot, you can use all of those muscles and strengthen all of those muscles. So a lot less deformity can come out of working out barefoot.
Love it. And so my next follow-up question, because we're getting such great answers right here.
I don't know. I'm going to get some feedback on this, I'm sure.
No, all good. When we see clients, or myself in particular, we have things where your feet are tilted out, where they call duck feet, or pigeon-toed, where their feet are pointing in.
Right.
So that could either be from hip alignments, issues with gait patterns,
Sure.
and then walking, either pronation or supination, depending on how your foot's tilted,
Right.
which I see can cause a lot of issues with people like, oh, my hip hurts or my knee hurts. Well, why? And I check their gait pattern.
Yeah.
And I know the general public is not checking their gait pattern.
No.
So
no.
talk to us a little bit about those type of issues, how you could fix those type of issues, and what it could cause if left untreated.
Yeah, sure. So some people are born with more of a flat foot or a low arch, and they might be in pronation a little bit more. Supination is less common, much less common than pronation. But most of the time we see pronation, it's because the foot actually got weak, and we're not using those muscles. So then the arch starts to come down. Many times we'll hear pregnant women, right, say, my feet grew. And why do they say that? Well, because there's a ligamentous laxity when a woman is pregnant, and the arch actually comes down, right? So it's not their imagination. They're not crazy ladies. But anyway, when our arch comes down and we go into that pronation, there's a lot of pressure on the inside of our knees and the outside, the hips. So we want to alleviate that and get out of pronation. And that's where an arch support comes in. A custom, like I said, is probably best for that, because you actually get to, really correct and find your alignment, your perfect alignment. So when you're out of that, then you're alleviating all the pressure on the knees and the hips and the back. I mean, there are some people that come to me for custom orthotics, not because their feet hurt, but because their knees and their hips and their back hurt. And they want that alignment. And when when you're aligned from the foot up, you achieve that. So it's really, really important. So yes, an orthotic or arch support, right, can help with that. But the true thing is, if you strengthened your foot, and made it strong and had that arch up again, right, that would be the best. So that's where the fitness comes in. I like to practice yoga and some Pilates, and I find that the strengthening just in those types of exercises are fantastic. But even, I'm not a weightlifter, Anthony, but I'm sure, like, when you're doing those squats and you're lifting, right, you're engaging all those muscles, you're strengthening all those muscles in the foot. So hence, you're getting better alignment, so to speak. Yeah.
Better alignment. I'm just gonna, for those that just getting to the gym or working out, we have a tendency to, I'm just gonna work my chest, my biceps, and my quads and glutes, and then you have overreactive muscles and underreactive muscles, and actually can make it worse. Am I wrong? Especially when it comes to feet.
Yeah. Well,
I know you have such a long answer in your head right now. I see it.
Well, again, I think just as if it's dangerous to treat a body part, it's dangerous to work out a single body part. So I do feel like a more well-rounded workout is so important. And again, you want the stability in your joints, right? You want the stability in your knees, the stability in your hips. And to achieve that, you have to have a strong foundation. You have to have strong feet. So they're overlooked so much, right? And most of us have sedentary lifestyles, so we're not walking during the day, and we're not using our feet as much as we did. That's a problem. And then the shoes, right? That's another problem. We've gone away from post World War II. We really got away from even natural materials in our footwear. So we are not even getting the benefits of the earth when we're outside, because we're not in leather soles anymore. We're in synthetic soles that don't conduct the earth's electricity. So yeah, there's a lot to that, but we need to take a step back and look down. Look down to heal up, I say. Yeah.
Something I want to talk about, just because a case study for myself.
Yeah.
I had a client coming to me, and she always had knee pain. And no matter what we did, her knees were horrible. And of course, people take a little while to disclose all the information. But I found out a few months down the line, she wore heels every single day. And I'm trying to explain to her, you're wearing heels every day. And I'm talking about some heels that are like
Right.
4 or 5 inches off the ground.
Yes.
And I'm trying to explain how that's causing her knee pain. And she's telling me it's not. So any
I'm
advice
laughing.
on that?
I'm laughing because for years, I wore heels into the operating room. So guilty,
skillful.
guilty. Yeah. Again, there are some conditions that raising the heel up might actually help a little bit because you're putting some slack on the Achilles. And you're actually if you're really flat-footed, when you lift the heel, it's called the windlass effect. When you lift the heel, you actually supinate a little bit. So you come in. So it could actually, in some situations, be a little beneficial. But let's face it. I mean, when you're in a heel, all of your body weight now is on the forefoot. So the poor forefoot, it just, and then when you add the pointy toe box, yeah.
And you're not getting any flexion. I mean, it's just constantly flexed out like this. You're not bending it at all.
No. So absolutely, shoe gear will affect the knees and the hips for sure. Yeah.
Love it. Now I want to move on to something you mentioned a couple of times.
Okay.
Earthing, which I have. This might sound like a silly question, but I am just so curious, and it's something I've thought about myself all the time. I'm laughing because I know the question coming out. You talk about getting your, especially people back when we didn't even have shoes, or back whenever, thousands of years.
Right.
Running outside, right? How in the world did these people run through a forest and not tear their feet up every single... Is that scar tissue buildup? What's going on? How can the foot handle that? Because I am so curious.
Yeah. Well, again, number one, strength, right? When the foot gets strong, it can handle so much more. But then you do have that really tough skin on the plantar surface of the foot. So it is protective. But we baby it by wearing all these soft shoe beds and whatever. But if you've noticed, if you're a beach goer and at the end of the summer, you really have a much harder pad that you're walking on. So yes, it does take conditioning. There are many, many barefoot runners. There was a book, Born to Run.
I've heard of that.
I believe that maybe came out 10 years ago or longer. And don't quote me on this, but the author was studying Aborigines from, I believe, South America. And they ran hundreds and hundreds of miles barefoot over the canyons and so on and so forth. So he wanted to study them because he said, how do they run? Ironically, they don't run heel to toe like we do here. They're toe runners. So they run on the ball of the foot. So anyway, it's great conversation. But it's a whole different.
I couldn't even imagine doing that. I want you to know that.
Yeah, but it's also conditioning. Our feet have an enormous amount of nerve endings that communicate with the brain constantly. And that's another thing. And that was a protective, right? A protective measure that the body has built in, right? When we're walking barefoot. So it's constantly sending messages to the brain. So we lose that stimulus too when we're not barefoot a lot. So you are seeing a barefoot movement. You are seeing a swing. Some people, I don't really agree with going into the supermarkets maybe barefoot, but there is a swing back to being barefoot. And earthing, for those of you who may not know what earthing is, it's actually receiving the earth's negative charge through the foot. So, and it's super important. Animals receive it all the time. We're not laying on the grass. We're up in elevated beds. So we're not, and when we're not using natural materials for shoes, we're not conducting that electricity. So we lose it. We don't benefit from it. But basically, the short of it all is it really helps combat free radicals. And when we have a lot of free radicals, right, it means, we're in a state of inflammation. And we know now that the root of almost all disease, including cardiovascular disease, comes from inflammation. So, so pain, inflammation is tremendously treated by earthing, walking barefoot, getting out there.
Is it good for your foot to have, like, you're walking on cold surfaces, hot surfaces? Is it beneficial? Is it not beneficial? Like, is there a certain extreme, like, hey, don't walk on that hot cement, it's 100 degrees outside, or don't walk in the snow? But how did our bodies used to handle it and not get frostbite or not get severe burns? Like, I just want to know, is there more benefits to negatives, or?
That's an interesting question. I'm not an expert on that, but, obviously common sense wise, right? And protect it. Your body will tell you. Your body will say, that's too hot.
My body says, don't wear socks, it's too cold.
That's too cold. But increasing our circulation, and this, Anthony, the more we work out and the more we use our muscles, the more blood vessels we actually produce. So it's called angiogenesis, and we form new blood vessels. So when somebody does have poor circulation, one of the things I tell them to do is movement. You have to walk more. You have to move because your body will create new vessels. So that's another thing. Sometimes when, we have cold feet, or, maybe our circulation isn't great, exercise is excellent to improve that. I must say there's one population that should be more careful than others, and that's people that have diabetes. Because they lose some of them lose circulation to their feet, but a lot of them lose sensation. It's called neuropathy, diabetic neuropathy. And because of that, they do have to be much more careful with cold and heat. So I've seen some pretty bad.
Actually, one of my questions to my trainers before they get hired, they have to answer that with neuropathy, because a lot of people don't realize if you're a client and you have neuropathy in your feet and you're working out, doing a balance exercise, you can't feel the same sensations in your foot.
Right.
I have to be ready to catch you or be a little more protective of what exercises we're doing.
Absolutely. Absolutely. So yeah, that is, it's crucial to know that. Some people do have neuropathy that of a cause that they're really idiopathic, they call it. They don't really know why. So you can ask that question just to the general population too. Do you have good sensation in your feet? Because it is a protective mechanism, right? And it does play a big role in balance. And that's another thing. People, right, today that we're so sedentary, we, to just do, I was doing my little yoga video this morning, and it was a tree pose, and I had a balance, and I'm so much better balancing on my right than my left. I keep falling over to the side. But it's interesting because balance is tremendous, and we don't really think about doing balancing exercises. But it does help with fall risk. It does help with just our general gait. People forget how to walk, believe it or not.
I believe it.
Yeah, so in practice, when I watch gait and I evaluate gait, if it's way off, I will send my patients to a trainer or a physical therapist for gait training to actually learn how to walk again the correct way.
I believe it.
We get into really bad habits too. Yeah.
I have another interesting question.
Yeah, go for it.
Love these little off cue ones.
Yeah.
Proprioception, only because you mentioned it with the tree pose. When you're standing, a lot of people, they say it's about 70% of what we're doing when we're in tree pose, which, by the way, for those that don't know, it's just basically standing on one foot, is visual feedback. So we're using our eyes to help us balance. Is there benefits to doing tree pose eyes closed? Because in my understanding, if I'm practicing that, I know where my foot is in space, and I'm learning how to be on the ground to communicate with the ground as a sense to just using my eyes to kind of balance.
Oh boy.
Yeah, that was a tough one.
Come on, Anthony. Can you get a little easier? All right. I I don't know how well I can answer that question, but I can say that for me, I can do those balancing poses much better with my eyes open.
A lot of
and
people.
I'm focusing on something. The minute I take that away, I struggle. So for sure. But again, it's it just shows you how the body works in concert, right? And that everything is linked to the brain. And
it's just interesting. It's more intriguing to think of it that way.
Yeah.
So we're going to go take this a step back before we kind of close out.
Yeah.
Any advice that you have for somebody listening, just general, maybe tips, tricks that they can use? Let's say they can't go see yourself or another podiatrist for financial reasons, whatever.
Yeah.
What advice can we give people as basic as we can get to kind of help them with their everyday routines?
Okay. Well, we mentioned strengthening, so important. Some of the activities that you can do strengthening wise is toe raises and heel raises, right? So toe raises and heel raises will give you a lot of strength in the foot. And if you are off balance, just hold on to something when you're doing that. But that's a pretty basic exercise that can help you out a lot. All right. Wearing shoes that fit appropriately, right? So wide toe boxes. I always tell people wide toe boxes. I happen to like New Balance because they usually,
also called the dad shoe. I want you to know
All
that.
right,
But
so
I understand
know,
it
but
now.
you got to give something up every once in a while. And fashion may be fashion. But yeah, wide toe box is important, and arch support is important. You really want to support that fascia. One thing I didn't speak about on the natural end of healing is salt soaks. So Epsom salts soaks are fantastic, not only for the foot and healing all sorts of inflammation and pain and tendinitis and skin issues. But also for the whole body. The magnesium is very good for us to absorb. So Epsom salt soaks, fantastic. You can throw some of your essential oils in there. I'm a big fan of that. If we want to relax, you choose your lavender. If you want to, have that refreshing feeling, maybe peppermint or something. So Epsom salt soaks or Dead Sea soaks, pink Himalayan salt.
What's a Dead Sea soak?
Yeah, from the all different types of salts.
Okay.
But salts are very healing. Again, not just for the foot, but for the whole body. So a warm foot soak, excellent. And some of the other things I said, get out there and at least 20 minutes you need barefoot, right? So cement, grass, and dirt will conduct the Earth's electricity. So
cement, grass, and dirt. Got it.
Oh, yeah. Not wood, right? So, but cement will. Yeah.
Love that. I have one more question just popping into my head. And just
go for it.
Sleeping. Barefoot with socks. Any thoughts on that?
Well, good question. If you are someone that has cold feet, and you really feel better in socks, do it. I happen to be someone that advocates for barefoot because you want the skin to breathe. Fungus loves darkness and moisture. So a lot of people suffer from athlete's foot and fungal infections in the toenails, and that will just enhance that. So getting your foot out of that moisture situation is the best. So barefoot, no socks to bed. However, some people have really dry, cracked heels. And in that case, I do say to put a little salve on the heel and cover it at night. You can actually use saran wrap. It's very effective if you have a natural, say, coconut oil, and you put it on the heel and just cover that with a little saran wrap. Works wonders.
That's awesome. That's great advice. And thank you for joining us on this week's episode of Health and Fitness Redefined. Don't forget, hit that subscribe button and join us next week as we dive deeper into this ever-changing field. And remember, fitness is a journey, not a destination. Thank you so
Anthony.
much for coming on, Dr. Dawn. Appreciate it.